Welcome to Supra Health and Wellness Podcast, your guide to personalized care, elevated living, and a healthier you. Brought to you by Supra Direct Concierge Medicine, where modern innovation meets compassionate care. Here, we dive into topics that matter the most to you and your well-being, exploring the latest in medical advancements, lifestyle strategies, and how Supro's tailored approach empowers you to take control of your health. Whether you're seeking prevention, convenience, or excellence, this podcast is your resource for living life on your terms. Stay tuned because your health deserves more than ordinary. It deserves Supra Direct Concierge Care.
I'm Dr. Raj, and I'm excited to guide you through this conversation while focusing on evidence-based strategies as well as discussing the importance of health beyond the scale. And in some ways, we can all achieve sustainable results.
So, Dr. Raj, why is obesity a problem? What are we supposed to do about this?
Obesity is a major American problem. It's actually a pandemic, as there's almost 40% of the U.S. population that can be labeled as obese because their body mass index is a little over 30.
So what should our BMI be?
So the body mass index has to be less than 25 to be non-overweight. So that way it's healthier for you in the long run, having an ideal body mass index.
So if you're just looking at people on the street, how do they know how to calculate this?
So basically, if they go onto their cell phone, most of them do have cell phones. They download an app or use an online version of how to calculate your BMI. There's hundreds of apps available in the market. So when they put their height and their weight in the app, it will give you a number. Now, based on that number, you have to determine where you stand. Are you ideal weight or overweight or obese? And that's how most people can calculate.
So what are the strategies that you recommend to help decrease this?
So, of course, you want to maintain a healthy eating pattern. This is crucial to good health. Additionally, how we eat matters too. You want to try and eat vegetables, fresh or frozen. You can go to Whole Foods, fresh, unsweetened yogurt, things of that nature will really help. Lean animal protein, seafoods, skinless poultry, whole grains, steel-cut oats, brown rice, barley, amaranth, quinoa. These are all healthy options. And when you're trying to look for an oil, look for something like an olive oil, avocado oil, or sunflower oil. And what you want to do is you want to eat less of the processed food or the sugary foods. Try and cut back on soda, your sports drinks, and obviously cut down on the refined bread, white rice, white pasta, red meat. Basically, that's pork chops, bacon, salami, ham, sausage. You want to try and cut down on that.
All the good stuff.
Yeah. Unfortunately, Melanie, the good stuff can sometimes be bad for us. So what I would say is instead of completely removing it out of your life, you want to cut down the portion. So that way you still get the stuff that you like, but in smaller portions. And there's a whole bunch of information available online on the websites. I like Harvard, Mayo Clinic, MD Anderson, and the CDC is my number one source for the common man and woman to get more resources. And I push my patients to go and read these resources. And when they come to our practice, we do share this information so they can look up online, get information, and I encourage every other patient in the country to go speak to their physician about getting more resources because why? They're available.
This is all about education, right? Prevention is education.
Absolutely. I believe the more you're educated, the better choices you can make, Melanie. And breakfast doesn't have to mean a big bowl of cereal. You can just do boiled eggs, some toast with nut butter on it, or a leftover piece of chicken, or an orange, or a low-sugar protein smoothie blended with Greek yogurt. These are all very easy to acquire, but you want to try and make it a habit so that you can make these at home rather than spending money at a fast food restaurant where things are all ultra-processed. You want to try to avoid that, Melanie.
This takes a lot of planning, right? Families are busy.
Yes.
And moms are busy
Yes.
going to practices, getting home late at night. What's the best strategy to try to do a pre-prep?
Of course, there's so many ways of doing this, Melanie. Some families that I've heard from, they package food for the entire week. They freeze them and put them so the next morning it's ready to go. So every day they have a different kind of breakfast so they don't get bored by eating oatmeal the whole week because it doesn't sound that appetizing every time. So when meal prep is most important on the weekend, spend an hour or two. The rest of the week you have food. That way you save money and you know what you got. Healthy stuff right in your house.
Then you can choose it, right?
Absolutely. You make your choices. Now you're the parent. You can tell the kids, hey, you have these two choices. Pick the one you want. And they're both healthy. So you make fewer mistakes and your upbringing changes everything for that child.
Excellent.
So what else I encourage is you want to take time and think about why you're eating, and if you're really hungry, then you go and get that meal. Don't just keep eating, snacking when you're not even hungry. For some people, it becomes like a habit. Hey, I'm just sitting down, I'm doing nothing. Let's go and reach for a quick snack. So you want to try and avoid just snacking when you're actually not hungry. And that's something I've emphasized a lot to all our patients. Include whole grains in your family's eating plan. When you're going to the grocery store, shopping for bread, pasta, rice, try and look for the whole grain options. It's always better for your family and for yourself as well.
What about, Dr. Raj? People talk about dehydration affects our hunger and the electrolytes and some of these sports drinks that you've mentioned. It's really easy just to go grab a Gatorade off the shelf to try to think that you're going to replace your electrolytes.
Absolutely. So see, that's a good strategy. However, most of those electrolytes, they have preservatives. The sports drinks have preservatives, Melanie. So I tell my clients, my patients, to pick the drinks wisely. Choose them wisely. Low sugar or no sugar is the best way to go. And if you absolutely have no choice, then pick a zero sugar version. And you want to also watch out for those additives, like sucralose, not very healthy. You want to cut it down, because they cause other problems in the long run. Water is your best friend. That will also help curb your appetite. So think about reaching out to water, flavor it with lime juice, put some strawberries, raspberries, blueberries. Those are better options. A drop of honey or two, that's another good option. Also, you want to try and snack smart, Melanie. Whole bunch of nuts, legumes, things like that are easily available in the store for consumption is what I'm going to push for my patients who are really trying to achieve an ideal weight. And when you're thinking about fish, try and get salmon, mackerel, trout, or albacore tuna. These are all great choices. And try and serve fish at least twice a week as family meals, and try and eat together as a family. It always encourages positive motivation, attitude, choices, and it helps bonding between other family members as well. You can use fresh herbs and spices, stock them in your kitchens, basil, parsley, curry, ginger, and try and pack your own lunches whenever you can. And that's my top priority. Packing your own lunch, you know what you got. You go through a drive-thru, ultra-processed food, you don't know what they're adding in that. Of course, it may taste very good. However, in the long run, it's going to do more harm. So my best suggestion is to actually cut down on the drive-through fast food restaurants.
But it's so convenient.
It is. Convenience is always there. You do it occasionally. Don't make it a daily habit for the convenience, because it'll cost you a lot in the long run. Because why? Obesity can drop your lifespan by as much as 10 years.
Wow.
Yeah, so now that's a significant number. And most people want to live long, and they want to live healthy and happy. It's the quality of life. With the ultra-processed food, the quality of life does take a backseat.
So you've talked a lot about weight. What is a set point weight that you always reference? What is this? Explain this a little bit more.
So the set point of weight is something that your body is already used to. It knows this is the amount of food that I need to make myself happy. And it's very difficult to change that set point as we get older. So determining the set point is very different for everybody. So that's the set point is the amount of food that you need to consume to feel satisfied. And the slower you eat, the better it is for you.
So do medications impact this? I mean, there's so many things that happen as we get older.
Absolutely. There's a lot of medications that can change the way you eat. There's a whole bunch of antidepressants that are available in the market and prescribed regularly that can actually increase your appetite. So you want to ask your doctor and see, is this going to cause me a problem with my eating? Ask your doctor to see if there's an option available for a weight loss medicine or an antidepressant that does not cause weight gain or that is weight neutral. So that's what I propose on to my patients, and we do discuss about this when they're with me doing any kind of management of their cardiac conditions, because there's many heart medicines like metoprolol, propranolol that can actually cause weight gain. So you want to see to some medications that don't cause much of a weight gain, and your doctor or your specialist will be able to help you with that in more detail.
And so many medications are take this 2 hours before, 10 minutes after.
Of course.
So it can get really confusing as to how much they're eating and why they're eating it.
Absolutely. So like, for example, a thyroid medicine, Melanie, most doctors will ask them to take it less than 60 minutes before their first meal. Why? You want that medicine to get absorbed well in your system. Because if you take a thyroid medicine and pop in your first meal within 10 or 15 minutes, that medicine is not going to be effective and you will lose the benefits because hypothyroidism can cause weight gain. So that's why go and ask your doctor and get more instructions from your team. Teams are available in any doctor's office to give you more details on how to take your medications. They research, they spend time. Make sure you ask the right questions.
It's really hard, right?
I agree with you.
Yeah.
It is pretty difficult, and it's a long journey. It is difficult to make those choices, and that the more you're educated, Melanie, the better it is for you and your family, okay? And people with depression, Melanie, they do tend to gain weight even if they're on medication. Because of what? Because of emotional eating. Emotional eating, they just want comfort foods. Comfort foods just calm them down, make them more relaxed, okay? And comfort foods sometimes cause weight gain. When somebody is stressed out, the first thing they go look for is a comfort food, which again causes weight gain. And thereby, it's going to be difficult to lose weight because you have to treat the underlying problem. And so you want to make sure, if you're trying to grab a snack from the table, you want to have healthier snacks. And that way you're not getting more into the comfort foods that actually make you feel good, like a bag of chips. So if it's out of your sight, then you're less likely to go and look for it.
So this really comes down to how we shop.
Of course.
How we prepare, what we have on our tables.
Of course.
Yeah, and so that's the prevention, right?
Absolutely.
This is what you believe in.
Yeah, I believe in prevention. The more you can prevent this medical problem, the more likely you would not need treatment. So prevention is the way I focus on with all my patients in the office, and I do my best to repeat counseling them.
So, Dr. Raj, we've hit on depression a little bit, but a lot of psychological factors cause weight gain. Can you tell us a little bit more about that?
Absolutely. Depression can cause weight gain. Persons living with depression have a high risk of obesity, and they had a 55% increased risk of depression as well. And those with depression had a 58% risk of becoming obese.
Wow.
And that's a very important factor because the prevalence of symptoms of depression in bariatric candidates is around 45%. And depression can lead to weight gain again through the mechanism of emotional eating that I discussed with you earlier today. It's like binge eating to just get comfortable. And so when you're trying to binge eat, you're going to get high-calorie foods and you won't focus on what is supposed to be taken in your system, and you won't worry about what's going in because you just want the comfort food.
A lot of people will go to bariatric surgery.
Yeah.
Right? And say, well, this is a quick fix.
Yes.
But then over time, their habits come back.
Of course.
And so the surgery is ineffective.
Absolutely. And you're 100% right on that. I've had a few patients who've already had the bariatric procedure done they're good for maybe 1 or 2 years, maybe 5 years. However, if their stress levels are not changed or if their depression is untreated, they never got the right pathway to maintain that healthy weight, it'll come right back. And I've seen it come back as early as 1 year. Somebody loses almost 50 to 80 pound weight loss over a year after the bariatric surgery, and it comes right back up just because of the way they were doing things in the past. The stress wasn't addressed, anxiety wasn't addressed, depression wasn't addressed, so it comes right back. However, even if it was addressed, they fall off the track, they fall off the wagon, and they go back to doing things the way they were doing before, and they gain that weight back. So technically, that surgery didn't help much. Even though that's not a bad option, it's a good option to get a bariatric surgery because they might have tried other things. But that being said, if they don't maintain what's a healthy weight and change their entire lifestyle, that surgery is not going to benefit them much.
And physical activity.
Of course.
Right? We talk about physical activity. When people get depressed, though, they don't want to exercise, but the endorphins that they feel once they exercise again or find one strategy that works.
Of course. So because, when you're depressed, they're less motivated. When they're not motivated, they don't want to do anything. Then the longer you sit down or longer you're watching TV, then it's less likely you're going to burn more calories. And so that's what causes a change in your metabolism. And you've got too much coming into the body, but not using much of your energy. And so this causes like an effect that every day you add on some weight, and in 1 or 2 years, you've gained 5, 10, 15, or even 20 pounds. So you want to keep yourself active, aerobic exercises, maybe 20 or 30 minutes right at home. Pull out a YouTube video, and that'll show you. And then most of them are complimentary if you don't have time to go to the fitness center. However, Melanie, if you go to a fitness center, you're somewhat accountable.
Right.
You're going to watch other people working out in the fitness center, and it'll take you in the right direction. However, when you're at home and trying to work out at home, sometimes you don't have that motivation because sometimes you're alone, and your spouse or your boyfriend or girlfriend says, well, I don't want to work out today. And that way it demotivates you. And guess what? You didn't get your exercise that day. And guess what? You've gained weight back again. So it's so important to be positive, motivated, get into fitness club, health club, fitness center. So because all like-minded people come to that place, and that energy there, the energy will help you get on that treadmill or start that elliptical machine or any other exercise regimen you're with, and that's perfectly fine.
So a lot of people want a quick fix, though, right?
Yeah.
Or they need it because of some chemical reaction in their body. And so you've educated me on this GLP-1 RA.
Right.
Talk to me about what it is. How does this work for people?
GLP-1 is a glucagon-like 1 peptide receptor agonist. Now, this is actually made in the body naturally, okay? So the medications that actually come into your system, which are subcutaneous injections for the most part, will help keep that GLP-1 alive longer. Because this GLP-1 helps decreasing the appetite by promoting satiety. And it modulates something called as the leptin signaling. Okay? Now there's hormones that the GLP-1 works with to help reduce the appetite. So that's how these chemicals work. So you will be less hungry for a longer duration of time. And also you will feel full much more easily, even with a small meal. So because why? It takes a while for the food to go through your gut. So the longer you're less hungry, it's less likely you'll go and get that second meal. So these GLP-1s work in that way, and they actually help, which is like a quick fix for most patients, and they're very effective, okay? And these GLP-1s, they're actually used to treat diabetes as well, and research shows that they can also be used for weight loss, the same exact drug, okay? So those are GLP-1s, and there's a whole bunch of them in the market. Ozempic, Victoza, Mounjaro, and Saxenda, which is the same name, as Victoza, it's the same chemical. Okay, it's the same chemical, but just marketed as a different name. So all these substances actually help promoting weight loss.
But these all have to be with a physician, right? Someone that is really coaching the person and the patient to be able to get the best results.
Absolutely. The physicians who have trained to learn how to prescribe this, or even other practitioners can also do the same treatment, will give them a pathway of how it works, what dosages you need to take to make it more effective in the long run so that it's also sustainable.
So are these blood tests that we take to find out like if these are effective or how this is working?
So you can do blood tests, but it's so difficult to say if a particular blood test is necessary before you start a GLP. However, there's a general group of blood tests you need to do and perform, which is like a CBC with a differential, a comprehensive metabolic panel, a thyroid panel, your vitamins as well. So do all these tests in advance before you start getting a GLP-1 treatment. And it's so important to find out if you have a family history of pancreatic cancer or a medullary cancer of the thyroid or an MEN type 2. It's another cancer near the adrenal glands. Make sure you let your doctor know if any of your family members or you've had these problems before you start this GLP-1 regimen.
How do you personalize a weight loss strategy just for any patient?
So before you start a weight loss strategy for any patient, first ask their permission. Ask the patient, are you okay if we have this discussion about a healthier lifestyle, rather than just saying like, hey, you're heavy or you're obese. They don't like it. You got to be respectful to the patient and ask them, hey, would you be willing to start a healthier lifestyle? And at that time, they may consider working with you. Otherwise, they may leave and walk away. So it's so important to try to avoid saying, hey, you have a weight problem. Because in today's short office visits, which happens everywhere in the country, hey, let's address your weight right away. So the physician needs to think about it. And I know it's very difficult for the physician to do it. And just come up with a nicer plan because they know their patient better. And say, hey, how can we address this issue of lifestyle changes and better, healthier, holistic way? Instead, ask, how can we create a sustainable lifestyle and help you in the long run? Okay? And also the physician needs to ask them, what has worked for you in the past? What has not worked for you in the past? And this is so important. So once the physician knows that something did not work for them, obviously, I don't want to keep trying the same things again and again. I'm wasting the patient's time.
Right.
So I'm going to offer other options that may be available.
We want results, right? Everybody wants results and the reward faster.
Absolutely. I agree with you. And so you want to try and go to options that are non-pharmacological to begin with. So once you do your detailed physical exam and make sure they don't have other medical conditions, masking what their problem is, you did your blood work, and get a nutritionist on board, a dietary person who's an expert in counseling them. This is the key. And make sure they don't have severe depression, because you're trying to treat weight loss when they have severe depression. So it's so important to first figure out what they have, what they need. And it's the physician's job or the healthcare provider's job to make that choice for the patient and give them reasonable explanation, Melanie.
Well, I've heard so many physicians talk about when they go through medical school, they don't have a nutrition class.
Nope. And you are 100% right. Now, some of the medical schools recently, within the last few years, give some options to students to do it, to get a basic nutrition class. But not all physicians may pick that one because they say, well, we've learned so much, we may not need this. Because why? They're used to referring the patient out to the nutritionist. Right. And you are 100% right. So it is the physician's responsibility sometimes to learn the basics and try and spend time, which is very difficult in today's medical setting.
It's really hard because there's so many specialized medical physicians, right?
Yes.
Specialized practices, but you have to get to the root cause.
Of course. Of course. Now, the physician may take more than one visit to get this address and the ball rolling, So that for that reason, Melanie, it's so important for the healthcare provider to refer them to the nutritionist within their system if possible. So, and then the nutritionist needs to reply back to the physician's office and say, hey, this person attended the first nutrition class or they attended their first counseling class, so they're on board.
So talk about the classes of medications that, we need to consider. You've talked about this GLP-1, RA. What are your recommendations as you begin with a patient?
Of course, there's a whole bunch of medication classes that are available. There's a medication called orlistat, which is a lipase inhibitor, okay? It impairs the digestion of fats and is available over the counter. However, some patients have told me the side effects, they feel bloated. They have like a very strong smelling stool with that orlistat. It does, however, help with losing some weight. Maybe 5% weight loss with orlistat. And there's a second class of medicine called as the bupropion-naltrexone combination. Bupropion is used as an antidepressant. However, naltrexone is an opioid antagonist, okay? When given in the right proportion, it's available in the market. This can help almost reduce 5% of the patient's body weight over 6 months, maybe even a year or two.
Wow.
Okay? And there's a third family called as the sympathomimetics, and that's called phentermine. Now, phentermine, the physician's office or the healthcare person's office needs to double check before they're a candidate for taking the medicine. Medicine works very well. They may lose about 10% of the body weight. However, if they already have high blood pressure, you want to think twice before you start them on phentermine. First, you want to control the blood pressure well, because why phentermine's side effect is to increase blood pressure and heart rate. So if somebody's got advanced cardiovascular disease, you want to try to think twice before you prescribe that medication. So these are the top choices that I use besides the GLP-1s. Of course, the GLP-1s have like a 22 to 25% reduction in body weight over 6 months to up to 2 years. Now, the GLP-1s specifically, which are the fad everywhere right now, are much better if they start slow and then advanced. And that way it's sustainable much longer, Melanie. Rather than hitting them really hard, you want to go slow. Okay, so it gives them a chance to get acclimatized to their new lifestyle.
And like you've said, changing your activity level, the foods that you're eating. It's not just about have a magic medicine that takes it all away.
Just the medicine is going to help you a little bit. But if you do not change your lifestyle, do not increase your physical activity, do not increase that aerobic exercise of 20 or 30 minutes a day for like 4 or 5 days a week, everything's not going to change.
And meal prep, you've talked about that.
Yes.
That is huge.
Yes.
That's huge.
Meal prep is so important. People ignore it because once they lose weight, they go back to doing what they were doing before. And then it defeats the purpose, Melanie. So it's so important to keep that meal prep going in the long run.
So in closing here, let's talk about just the 3 main principles of weight management, Dr. Raj.
Yeah. So the biggest 3 things that I feel are very necessary is balanced nutrition. Second thing is regular physical activity. And third one is a mindful lifestyle choice that you need to make and adapt. And these 3 things, don't just do it for 2 weeks or 4 weeks or 6 months. Just change forever. That way you will see your physician less often for other complex conditions.
We'll stay healthier.
Absolutely. And they stay healthier. Their mind is healthier. They feel better. And this is a better lifestyle in my thought perspective.
That's awesome.
Thank you.
So how do we contact you, Dr. Raj?
Of course, First of all, I ask everybody who's listening to this podcast to reach out to their physician. And our details for Supra Direct concierge medicine is on our website. It's called suprodirect.com. And our office number is 317-300-7424. You can call at any time. Amanda, Nadia, Lisa, Jenny, myself, or Dr. Sumakaridi will be happy to answer any questions you may have. And we have a new doctor. His name is Dr. Abdul Rahim Khan, who's also willing to do his best to help our patients.
Thank you very much. Thanks for all you do in the community.
Thank you so much for having me here today, Melanie.